Babies come with lots of questions, and so I am super excited to welcome back our returning champion of moms and babies, that is, Dr. Lauren Crosby. Hey, Dr. Crosby, good to see you
Thank you
again.
so much for having me back.
Well, we have lots of questions from our community, and I'm going to dig right in. The first one is, I'm giving birth in 2 to 3 weeks, and I'm wondering how I will protect my baby when leaving the hospital and on the ride home, car seat aside, I'm assuming. Are they giving babies masks to wear? Should we wash them once we get home? And I know the baby mask sounds super cute, but I'm assuming not safe whatsoever.
Right. So when leaving the hospital, of course, you're going to get into your vehicle. And like you said, you'll have your car seat. It'll all be safe. And when you get to your house, you're going to go inside and you're going to wash your hands again. And you're going to, I would give the baby a sponge bath because they're not going to be submergible yet anyway,
Right.
but it won't hurt to sponge off that baby and even shampoo their hair. Masks are actually not okay for kids under 2 years of age because of the risk of suffocation.
Yep.
So it's a no to the mask.
That's what I thought.
Yes.
So the next question is, will social distancing, this is actually a really interesting question that I hadn't thought about until someone asked it. But the fact that we're social distancing, and so we're not exposing babies to all the faces that we normally would, you would say, besides grandparents and doting aunts and uncles and cousins, you would be taking your baby out and baby would be seeing all kinds of faces in the store and in the park. And now they're not. So
Right.
How will that affect a baby's social development? I've heard some moms say that their babies are having stranger danger extremely early, even when going to the doctor, which is probably a normal reaction anyway. So what do you think about that?
Yes, I'm used to that. Well, of course, with newborns, we want you to stay away from others anyway.
Yes.
Until we usually say until vaccines, we really super limit it. And now, of course, we're limiting everybody. And really, most of the time, the parents' faces really are enough. And so I do want to reassure people that if you're talking, that's all they need.
That's
if
all
you're
they need.
talking to your baby a lot, that's the most important thing, is that face-to-face and hearing your voices.
Yes.
And I think playing some music is good. And I do think classical music is good. But I don't think having like a TV running in the background all the time is going to be something good. It should be your voices and your face. And I always tell parents to narrate everything they're doing to the baby, no matter how old the baby is. So we're going to change your diaper now. Oh, this might be cold. Like, just talk constantly. And
even though your baby has absolutely no idea what you are talking about, you are getting your baby to eventually speak his or her mother tongue and father tongue. So it's super important. And you are your baby's best teacher, right?
Absolutely.
First and best.
Yeah, so they don't need a ton of people around them for them to develop their language and socialization. They need you and your face and your reactions and your emotions. And they do, I think it's a good time maybe to talk about picking up on your stress, because that also can impact the baby and how they feel and their development too. So it's a good time to check yourself and be like, I'm feeling stressed. Let's wait to pick up that baby for a second and take a big breath, and, maybe ask someone else to go pick up the baby that moment while you get your breath if you can. So it's also something to think about.
Yeah, especially if you have a new baby who's crying a lot, and ordinarily maybe you would have the support system. Maybe your mom could come over if you're super stressed, and now you can't have that support system. It's all you all the time. So knowing it's okay to let the baby cry in a safe place like the bassinet or crib for a few minutes, so that you can sort of collect yourself and maybe count to 10 or visualize something super sweet, and then you feel better equipped to handle it.
Yes, drink your water that you need. Hydrate for a minute. That's doing something for you, and it'll make you better for your baby too.
But bottom line is eye contact.
Yes,
eye contact. Smiling, all of those cues that baby looks to. And you're feeling distracted, maybe you're working from home. It's super important to be focusing on your face, your baby's face-to-face connection.
Yes. Absolutely.
So the next question we have is, the cabin fever is real. It is for all of us. But when you have a new baby and you're not allowed to go outside, is it safe to take a walk with your baby, and how would you recommend doing that?
Yeah, I mean, I think it's important to take a walk with your baby. I think for your own health, being in nature is good for everybody. Being outside, exercise is good for everybody for
Yeah.
so many reasons. So I think it's good for the caregiver, the parent, and it is good for the baby, and it can be soothing for the baby. I know, like my first one, he had to have a few of those outdoor walks a day because
Oh,
he's
yeah.
kind of a fussy, colicky guy, and that really was soothing to him. So it's very good. You do want to just maintain that social distancing, and you can always, watch when people, you just have to be on the lookout. So if people
Yeah.
are coming a little close, you're going to be moving. I mean, we're doing it
Right.
in our neighborhood now. There's so many people walking and a lot of people
Exactly.
with their dogs or their kids on their bikes. So even have your little receiving blanket. If people are getting close, you throw that over your stroller and cross, I think there's ways to
Or,
do it
or,
safely.
we discussed last time, you can wear your
Yep.
baby, and if you're wearing your baby is definitely more protected.
Yes,
You
absolutely.
can still wear a mask.
Yep, you can still wear your mask. And like we said, probably if you can have that baby facing in, probably safer too.
Exactly.
Yeah.
So my mother-in-law saw our newborn outside, but they were not 6 feet apart. My husband keeps trying to take the baby to see her. Is it safe? And I want to preface this by saying I feel you. I totally feel you. I feel the mother-in-law. I feel the grandmothers, and I feel the aunts and uncles who can't see the newborn. But what do you suggest?
No, and I have been literally asked that exact question multiple times about children of varying ages. And, the bottom line is you're supposed to quarantine just with your own family unit for safety reasons. And, in general, even if both households are being quarantined and not seeing anybody, there still are things that may come into your house, either by way of going to the market.
Yes.
And so you have to minimize as much as possible right now. And if it's an older child, like a 4-year-old, their impulse will be to run over to a person. So again, it's not safe to risk it for that reason. Even if you've been isolated, you're still not 100% isolated, so it's not recommended,
That's true. And it makes it super hard to be that close and yet so far.
Yes.
Because 6 feet is so far when you want to hug.
Yeah.
I couldn't even handle that.
It's better to do it like this, like with Zoom or FaceTime. And some people have, like, even my sister and I had this on yesterday when she's an artist and she was painting and then she was talking, and you can kind of have it on with your friend or your sister or your mother-in-law, the grandparents, and just be around, that way.
The next best thing to being there.
Right.
Without the constant nagging.
There you go.
So the next question is, I have a mild fever and sore throat, no other symptoms, and a lot of people we know are asymptomatic or have very mild symptoms with this. Should I continue to nurse my 3-month-old? In general, is it safe to breastfeed if you're not sure whether you have COVID-19 or not?
Right, and that's kind of two parts to that, because one is, in general, the word is that you can give your baby breast milk if you do have it. As of now, it's considered okay. Just like with things like the flu, we let moms breastfeed.
Yeah.
And though this is a different illness, it looks like it is okay, the breast milk itself. Now, if you are sick, that's something different, because a child, especially under a year of age, is at higher risk for complications and getting sick from COVID-19 versus even a kid over a year old.
Yeah.
So if you are sick, if you can get tested, fine. If you can't, assume you have it, and you really should stay away from the baby, at least 6 feet away, and pump and have someone feed that baby until you are 72 hours free of fever, if you've had fever, and otherwise until it's 7 days from the first onset of symptoms and you're on the mend, like feeling much better. So that's the absolute safest for that baby. But the milk itself would be fine. And, I think some people are nursing anyway, even though they're sick and really are insisting or really want to and just don't feel good otherwise. Then they've got to wash hands before. They've got to also clean their bodies. They've got to wear a mask during the feeding and then wash again after, and just to be.
And that would hold true as well for a baby who's being fed a bottle.
Bottle too. Yep. Whoever that designated caregiver is, if there is someone else who's helping, has to also.
Exactly. And that's always the big if.
Yep.
You know, if
there
your
may not be anybody to
no
help you.
partner,
Yep.
and you're all by
You just have
yourself,
to
and
be-
just take all of those precautions that you can to feed your baby
Yes. Absolutely.
safely. Okay.
Yeah.
Now, how about those well baby visits? I can't tell you how many questions I've been getting about this. Either mom's afraid to take their babies, or dad's afraid to take their babies to the scheduled well baby visits because of fear that their baby will be exposed to COVID. And you know, also just sometimes the scheduling, because doctors' offices are so crazy busy, or maybe they're cutting back. Some pediatricians maybe not seeing as many patients.
Right.
What do you say about that?
Well, the American Academy of Pediatrics recommends to keep the well baby visits for kids under age 2 years, so that we can keep those basic vaccines up to date, so that when the world does open up, your baby isn't opened up to catching these things.
Exactly.
So most pediatric offices are super conscious of that, and they are really limiting who does come in. And so you do want to check that out. But for instance, what we are doing is we only have 2 doctors there on a day, and we have super limited schedules. We also have people stay, we have room in our waiting room where if there's 2 in there, you can either wait in the hall, or you can be 6 feet apart. There is space, and we pull people back because there's plenty of rooms to get them in right away, so they're not with anybody else. And we're only doing those checkups. We're not having any sick people come in. And this is what a lot of offices are doing. We're checking everyone's temperature who comes in. We are calling ahead to make sure nobody's sick. We're not letting them bring a bunch of people or even siblings. So it's super, super screened and super limited. We're all in protective equipment. So we wear our gowns, our masks, goggles, gloves. I'm covered in everything when I'm going in to see these babies right now. And of course, tons of hand washing. And so everyone also, we're telling them to wear a mask, even the kids over age 2, and we'll give them one if they don't have one. So it is good to go in and do it, but you know, check the office, see what they're doing. Most are doing it this way though, super limited.
So, but another question I've been getting is, how long can you delay vaccines if for some reason, you know, there's been scheduling changes? Right. Is there a safe amount of time that you can space vaccines, or are we adhering as close as possible to the CDC guidelines?
We're trying to stick as close as possible, only because also if you're behind, then when the world opens up, you'll still be behind.
Exactly.
And so that's an issue, is if you have a 6-month-old who's had 1 set, then they haven't built enough immunity up. By then, normally that'd be their 3rd set. So that's another reason why just some is better than none, for sure. So if that's the best you can do, that's the best you can do. And then you'll catch up, because there is a way to accelerate the schedule a little bit too. Like, you don't have to wait 2 months. Some of them are just a month apart that you can give, so that you could accelerate it afterwards. That's what I will recommend to those who've really been too afraid to come in.
That's super reassuring. And I know a lot of people have asked about the Tdap, whether they should be getting that during pregnancy. And I say, of course, absolutely. Sort of more important now, simply because we want to protect our babies even more, and protecting against pertussis. If you have some immunity to pass along to your baby before your baby can get that first DTaP shot.
Yep, absolutely.
2 months. So what are some coronavirus symptoms in babies and children? And you mentioned that newborns are at somewhat greater risk up until age 1. But I imagine there's also underlying conditions that might make an older child more vulnerable.
Right. So, I mean, in the pediatric population, they're still seeing overall, not just specifically for littles under a year, but overall, it's still fever, cough, shortness of breath, fever, cough more than shortness of breath, and not as much as the adult population, where almost 90% who are sick really show those symptoms. It might be more like 70% in the kids. Other symptoms can be nothing much. They could seem like they have a cold. So, and that's why we've noticed in general, the number of cases in children, when you look at all the statistics, it actually is relatively low compared to people in their 20s, 30s, 40s, and going up. So they do get it, but they may not either seem sick or they may not seem very sick. Thank goodness, but they could still have it. So right now we're telling everybody that any symptom could be it. And so that's why you just have to assume that if you're sick right now, especially, you should assume that it is that. Unless, of course, it's potentially something else. But even diarrhea, they're seeing more and more GI symptoms. Yep. 10% or more have GI symptoms, and it often is diarrhea and loss of appetite first. And then they may have some vomiting.
Especially in babies.
Yeah, and you can see that in the little ones too, diarrhea for sure.
Yeah, and that's, of course, a symptom that should always get checked out.
Yeah, at least always call. I mean, we are doing these video visits, as many pediatricians are doing the telemedicine video visits. So it's super helpful. We can see them and see how they look and see, oh, you know, and triage that way. Triage meaning what should you do next, right? What's the next step? So
even for things as simple as diaper rash.
You know, and yeah, diaper rash, we use it for that actually a lot, and a lot of other skin rashes too. We've been able to look at, and skin infections and eczema and things like that.
Which is actually, I mean, I would say that's actually a good thing, rather than always having to go into your doctor to check out a rash. Just having the ability to show it video is so much easier and exposes your baby to so much less, right?
Absolutely. Yeah. And you know, it overall works well. I mean, there's some situations where we might be over treating a little bit because we can't see it in person. But we always give guidelines. Like, I would do this if it's not better in 3 days. We have kind of a 3-day rule with lots of things. If it's not getting better in 3 days, to call back or check in again. So yeah.
Yeah. It could be one of those nasty yeast infections.
Be
Diaper area.
Yes.
Very familiar with those.
Yes.
So my daughter is 21 months old, and I am 29 weeks pregnant. We have mild symptoms, no fever. Will we get antibody tests? And I guess the bottom line is everyone is curious about antibody tests, when they will be available, will they be effective? Especially with so many kids having such mild symptoms, and some pregnant women as well having very mild symptoms. How do you know whether you have gained some immunity against coronavirus?
I mean, for that specific question, I would first say that she should get tested if she can. I mean, there is much more community-wide testing available in different cities now. In LA, it's much easier to get a test now. There's several urgent cares that are even pediatric ones that are even testing the parents. So that would be like a perfect case to actually get tested. And that is more sort of important to know than the antibodies. Now, the antibody thing, it's just kind of emerging. It's kind of the Wild West. Like, people are coming at it from different angles with different tests, and some are FDA approved and some are bootleg tests from other countries. And people don't really have enough data to know what to do with that data yet. So it's being tested. So if you have antibody, in other words, it means you have been exposed and your body mounts an immune response, and you could test for that in the blood. That's sort of an easy way to explain it. But what we don't know is, if you have antibodies, does that mean you're immune? We don't know. You might not be immune. Or how long does that last if you are immune? Is it 4 months, 6 months, a year? And so those antibodies might not do anything. And also, there's false positives with those tests, false negatives with those tests. Or you might get tested in a window where you haven't made the antibodies yet, but maybe you did have it. So there's so many things. And the other thing about the antibodies where it could be super useful, though, if you do have them and have maybe high levels, though they still don't know if you have a high level, does that mean you're more immune than if you have a low level? So everything's being tested right now. But if you have antibodies, you might potentially help someone who is sick, because they are looking into using those and giving those to sick people to see if they can help them fight the virus. Those are in the hospital. So
the plasma.
Yeah, potential uses for it. Yeah.
Ideal. So say you have a toddler, like this mom does, who gets a lot of ear infections. Certainly Emma got tons of them when and having less exposure to other kids is going to help avoid getting colds that lead to ear infections. But if you have a child with recurrent ear infections and you're afraid about taking, or any other kind of illness, you said you're not seeing sick kids. So what should parents with sick kids do if that baby or toddler actually, might need to be seen? Is that something you can handle via telehealth?
Yeah, so we're trying to do it that way. So depending on the age of the child too, because of course there's some kids who are good and can, at recognizing what's bothering them, or able to recognize what's bothering them and verbalize it. And so if they can say, it's my ear, and this kid has had a cough, cold, runny nose, something that, or even allergies that could set them up for having their eustachian tube clog and getting an ear infection, then those often we will do a telemedicine video visit with and kind of look at the kid, get the history, and often treat empirically, meaning, without actually see them, and assuming that it's that. If they don't respond, then of course to touch base again. And, there are kids who have ear tubes who've had a lot of ear infections. So they have the tube surgery to help ventilate that middle ear. And some of them, the drainage is coming out, so you can tell it probably is infected. And then we would call in drops. So we do telemedicine for those visits too. And then if they don't respond to treatment, then we would recommend something else. There are a few urgent cares that are seeing those kids if they really do need to be seen.
Okay.
But I had a patient who was 2 and had a long history of ear infections, and she just wasn't sleeping, and it wasn't teeth coming in. She was not able to sleep, and she had had an ear infection a few weeks before. So we did bring her in because she was 0 sick, like no symptoms of anything. And her ears looked bad still. So, but she wasn't sick, but we could figure out why she wasn't sleeping. And then we ended up treating her for that with something stronger. So
yeah, sounds very familiar. But of course, in general, if you're always giving your kid antibiotics for ear infections, other risks that are attached to that. So, there are cases when you could just wait and see if it resolves on its own.
Yeah, so there are kids where if it's borderline and we do a video visit and I'm not sure, a lot of times I'll say, why don't we do the following? Let's keep them on ibuprofen. Yes, ibuprofen, it is okay to use for 48 hours, every 6 to 8 hours for 48 hours, and then stop. It's anti-inflammatory, so maybe if something's brewing, it'll calm it down, and then their own immune system could kick in and maybe fight that ear infection if it's happening. And let's say they're great on it, you stop it and they're miserable again, that would make you inclined to treat that one.
So speaking of immune systems, last time we spoke, we talked a little bit about how you can boost your child's immune system, and your own for that matter. And of course, the gun things are not necessarily appropriate, but what about probiotics? Are you pro probiotics?
I am. I don't think that they're the panacea for everything. I think they work best for intestinal infections more than anything else. Or antibiotics for sure. I always recommend, if a child's on antibiotics, to take probiotics too, to keep their intestines balanced and prevent complications in the intestines from the antibiotics, and prevent diarrhea, and maybe help with diaper rash. So I definitely like them. I don't think that they are the answer to the full immune system boost. I don't think they're going to keep you from getting bronchitis, pneumonia, or COVID-19.
Right.
Some people,
but
are they safe? Will it hurt? No.
No. And certainly when it comes to keeping your immune system healthy, there's no substitute for eating well, healthy diet, getting exercise, getting enough rest.
Yeah,
just in general.
Hydration.
It's not going to prevent COVID-19, but it will boost your immune response.
Yeah, that will help you the best if you get it. Maybe you'll get through it a little bit better because you are hydrated and eat lots of veggies and fruits, lots of colorful, healthy foods, and rested, and exercise too.
Absolutely. So here's an interesting question. We're still hearing some moms having trouble getting their normal formula in the stores. And yes, you can order them, but maybe it's going to take a long time, or it's prohibitively expensive. So is it okay to switch to another formula, assuming your baby is willing to switch? Or do you need that okay from the doctor first?
I think that it is okay, unless if you have a baby who has allergies, you have, and it's on a special formula for certain reasons, whatever it may be, whether it's a special preterm formula or if it's hypoallergenic, that's different. But if you're on a regular cow-based formula, cow milk-based, and you have to switch, it's okay. We don't like to, because we, you know, maybe they're a little different, and maybe it's the baby won't like it, or the taste, or they might be more gassy or something else. And you could potentially talk to your doctor about which would be a good choice based on the one you're on. But overall, I mean, if you're desperate and you are running out, that's the way to go, versus giving like regular cow milk to a baby under a year. We don't want to do that. We don't want to give them like almond milk or any of those, you know, non-dairy milks and non-baby formulas. So
exactly. And another point that you had made, which is super important, is that, you know, if you're strapped, that it's not okay to over dilute your baby's formula ever.
Never, never, never. So some people go, okay, I can make this can last double the amount of time if I add double the water to it and dilute it, but that's extremely dangerous. Never, never do that. That can really cause electrolyte imbalances in the baby and lead to seizures and dehydration and horrible, horrible complications.
Yeah. Such a good reminder. You know, we're home, we're desperate, times call for desperate measures. And so we might be turning to more screen time for our little ones. And I guess some moms are concerned that how much is too much, and whether we should cut ourselves just a little extra slack these days.
I think it depends on a couple things. One is the age of the child. Two is what you realistically have to get done that day uninterrupted. So one is, you know, kids under 2 really should have the absolute minimum, and 12 months and under 0, really. Yeah. So unless it's maybe FaceTime for fun, you know, with a family member, so it's a face and it's more interactive and more social. But over 2, if you can also make sure it's an educational type of a program, and then maybe rewatch it with them later and talk about it, or ask them little questions about it, or sing and dance and make something that makes them get up and move and dance, sing, so that it's more interactive for them. That's always better. But they are going to have more of it, and you have to use it sometimes. If you have both parents, or just it's you and you don't have any help, and you have a meeting, or you have to write something that has a deadline, you're going to put on a movie, maybe twice, because you need 4-hour break, and you should make up for that afterwards. So get on the floor and play with them afterwards. Go take a walk and do a lot of one-on-one interaction and playing games together, art, building, talking, and make up for it.
Exactly. And even if you can do your work while you're sitting next to your child, so you can swoop in every now and then and interact in some small way, so that it's less one-sided with the TV.
Do a little check-in.
Yeah, exactly. So we're almost out of time, but I do have a question about visitation rights. We've been getting this increasingly. So if the child's father is perhaps not taking social distancing seriously, or works in the front line of healthcare, is an essential worker who might have extra exposure, is there a way to limit or perhaps pause those visitations just to make sure you protect your baby or your child?
Yeah, I mean, I think it's a great question. Also, you, of course, are going to look for what's in the child's best interest for health and safety. But because of COVID-19, other people's health and safety do come into the picture. So there's a couple things. One, if it's, you know, a custody situation, I'm hoping, and I've had to mediate with this between some parents, is we want them to come to the table wanting to find a solution. We want them to come to the table knowing that there has to be flexibility now. This is a pandemic, and it's not going to be like, oh, you have more time or I had more time. You can make deals like you can have more time with her or him. Maybe after, when the restrictions loosen up, I'll pay you back. Or, you know, if some parent doesn't take the pandemic seriously, I do feel that that is a problem, because I don't think that they should be the ones to judge that a pandemic isn't serious. It's clearly serious, and it needs to be taken seriously for everyone's health and safety. So I had one family, a mom, email me, CC the dad, and had all her questions so that I could answer them both with what I thought would be the best solution for them, and had them weigh in. And I thought that, and it worked out actually very well without having to get lawyers and courts involved. It's nice if people can communicate and try to work it out. But someone may have to give a little bit, and they have to be willing to have flexibility. If you have a healthcare worker, let's say who's, you know, coming home, or, you know, someone who's out on the front lines, and if they can change their clothes first, even before they get in their car, so they don't even contaminate their car, you know, and then when they get home, strip again and shower really, really well, that's probably the best you're going to get. Besides, there are some people who are working in ERs where they're just covered in COVID or on COVID units. Those people, it would be safest for them to even stay away for a while until we know how they are, you know? So I think case by case, but if you're a COVID unit person and you're intubating and it's all over your body, you, I would hope, would want to do the best for your family and maybe stay away, or just really be like extra careful. Those are so important. And the social distancing thing, I think that to make that decision is going to be hard, because we can't make a decision, but if you have someone who can mediate and help you, who's more neutral, like I was, I think that it was helpful to get them through it.
Well, I think that those parents are super lucky to have you as their pediatrician, as are all of your parents and patients. And we're super lucky to have you in our What to Expect family. So I want to thank you, and can't wait to see you again.
Thanks so much for having me. Take care, be well, be safe.
You too. Lots of hugs.
Bye.
Bye.